This is Mississippi Edition on MPB Think Radio. I'm Karen Brown. The trouble for Mississippi hospitals started amidst the COVID-19 surge this summer when nurses began to leak out the state in pursuit of eye-popping hourly rates for their services in places like Texas and Tennessee. Mississippi's Emergency Management Agency brought in hundreds of medical professionals on short-term contracts to fill the gap, but those deals expired at the end of October. Now the state is feeling the full weight of a profound nursing shortage, and experts say they're worried. Susan Russell is Chief Nursing and Safety Officer for the Singing River Health System. She speaks with Desiree Frazier.
This time last year, we had zero contract and agency staff working in our inpatient nursing area. And today we have 12% of our openings that are filled with contract and agency. Plus, we have almost 300 RN openings in our system. And the 300 openings don't take into account that we have more beds closed strictly due to RN shortages than we have ever had. Since last Friday, we had to close an additional 15 beds in Pascagoula, in addition to the 18 beds we had to close almost 2 months ago due to shortages. And we have an 8-bed ICU that had to close last November in Pascagoula, once again on that one campus, just due to shortages. And that is a bed today I could put patients in waiting in the ED. Our Ocean Springs campus did close 30 beds on Friday, and our Gulfport campus had to close 15 beds since Friday, once again, as the MEMA nurses got extracted, and we just don't have nurses that are available to take their place.
What does that mean for the services?
It means extreme stress and pressure, also delays. You know, right now it's a little bit better day than we've seen in several months. By that I mean our normal ED volume is down by about 25%, which we have seen throughout these COVID surges. Afterward, there's less patient demand in the ED. But even with that less demand, like you said, on our campuses, we have patients that need to get into a regular hospital bed that can't get into a hospital bed because there's not a nurse to take care of that patient. So you can see when the volumes go up, as they typically do, it's going to be more of a demand and more delay. The last couple of months, it's very common for me to get a call about, why can't my mother, brother, sister, cousin get in the hospital? You've got beds that are there, and it's not a bed issue. It is strictly an RN plus other additional staff. There's widespread staff shortages. We see that even in fast food restaurants. But the issue is there's only a finite amount of RNs that can work in these hospitals. It's called acute care nursing. And on top of that, specialty areas like ICU, OR, labor and delivery, it takes another year of training to get these individuals where they can work in those areas. So, even if I had a brand new RN today who was going to work with me, it's not going to help me open up that ICU until they can get months or a year's worth of training to get them where they're able to do the work they need to.
Does that mean that patients are flown to other facilities? How do you manage that?
Well, right now we are managing because of the lower volumes, but I can tell you there is an entity in the state, it's part of our state system of care, where we have gone under what's called MedCom. That is where patients from lower functioning facilities, that means like rural hospitals that don't have the breadth of service that we do, would send their patients to us. And I know during the fourth surge that we had that started the very end of July and ended just a few weeks ago, we received over 100 patients throughout the southern region that were shared between ourselves. We're a level 2 system of care facility, which is the highest functioning system in the state other than the one that UMMC operates, which is a level 1. And those duties were shared with Memorial of Gulfport, Forest General. And like I said, all of our hospitals helped out those lower functioning hospitals. But what happened was during the last surge, there weren't enough staff to take care of those patients. So many times there were very, very long delays in our ED. We had to postpone services such as surgery, cath procedures, and other things just to try to make it through those few really difficult weeks. But since then, all of those level 2 facilities have had to close additional beds. I know I'm on a CNO call, which is chief nursing officers with Forest General. Forest General said they were going to have to close another 75 beds, which probably have closed by today. That is very scary because they were still holding patients in their ED as well. So definitely safety and your likelihood of having a good outcome is decreased by not having an available bed that is staffed by a trained RN to take care of you.
This sounds very frightening.
I've been in healthcare for 38 years, and I'll tell you, the last week has probably been the scariest I've ever been through.
MEMA has contracted for healthcare workers for 60 days. You know, that ended October 31st.
Yes.
The agency says that hospitals can contract workers on their own and then reimbursed by FEMA. Is that an option that you can consider?
That is not totally the way the program is worked up. The state, but, you know, clearly the hospital can pay the funds, but, you know, you're looking at costs that are around $150 an hour per nurse. Clearly, healthcare systems, and in this state, you're looking at predominantly nonprofit facilities, cannot continue to pay those rates. We are paying very escalated rates, but right now we are to the point we cannot continue to pay $100 plus for every single RN. Plus, RNs are working on that crisis rate, which is what MEMA pays, and once again, being taken out of state to Texas and Florida where those rates are still available. You know, it's just unsustainable for hospitals to pay $150 an hour to staff their beds. They just can't do it.
What is the answer in your estimation? Is there an answer?
There are a series of answers. There's not going to be just one solution. The biggest thing that I can advocate for is something from the state to help retain nurses. That's the first thing. Stop the brain drain. Stop the bleeding of our staff to go work on these contracts and agency for these agencies that they feel like, you know, like I said, it's a once-in-a-lifetime opportunity for these nurses to make this kind of money. But if we can just incentivize staff to stay where they are, it will start the stabilization process. We know these crisis and high-cost agency travel contracts will go away, but we need time for that to happen. And in the meantime, citizens in the state need care. So what's going to happen for the next 3 or 4 or 5 months if we don't get some stability? So that is the concern of every chief nursing officer. Just get us some time. And I don't think it's going to be another MEMA contract. I do think it's going to need to be a retention bonus for agreement for you to stay here for another year, 2 years. This is what the state, through its CARES Act, can pay you to retain you. It would cost less to retain than to keep recruiting in these individuals who are only here for 8 weeks, 12 weeks, 10 weeks, whatever it is. At the end of the day, they're not going to stay in the state because there are nurses who want to stay in our state, in our system, but we have to financially make it worth their while not to travel, knowing these contracts will start dropping off in a couple of months.
Susan Russell is Chief Nursing and Safety Officer for the Singing River Health System. This has been Mississippi Edition on MPB Think Radio.